Welcome to Tuesday's edition of COVID-19. The daily tally here in Korea is back within double digits, but authorities remain concerned amid continued outbreaks, that is, at senior care centers and a possible outbreak at entertainment facilities in light of Halloween celebrations this coming weekend. We start the program now with the latest numbers on the pandemic with our Kwon Soa and related news with our Kim Dami. Now, Soa, there's been a slight decline in cases here in Korea on this Tuesday.
Yes, Sunny, it is a relief to be back to below 100 as the country has reported 88 new infections this Tuesday. But the figures have been fluctuating between the double digits and the triple digits a lot recently. And in the blink of an eye, the virus can surge again, so the situation can change anytime. And on this graph showing the daily figures from last Tuesday to this Tuesday, we are seeing those ups and downs. And we had 3 times when we had cases above 100, and the average is at 96, so pretty close to 100. And with that, the total number of cases here in the country stands at 26,043. The death toll at 460, with 3 additional fatalities reported in the past day. And a little over 1,600 people remain in quarantine. And there are also people, around 50 people who are currently in severe or critical condition, while there's also almost 24,000 people who made a full recovery. Now, just like yesterday, the highest number of infections were detected in Gyeonggi-do province with 35 cases, followed by 24 in the capital Seoul. Also 5 cases here in Daejeon as well as in Gyeongsang-Namdo province. And this Tuesday, we have 72 domestic infections and 16 imported cases. That includes 7 cases from the U.S. And speaking of which, so let's take a look at the global figures here. At 8.9 million cases, the U.S. added some 73,000 cases in just 24 hours. And the U.K. has become the country with the 10th highest number of infections. And if we move over to other places, all of these on this side have over 500,000 cases. And we also see resurgences in Germany with 12,000 new cases added. Also, Bangladesh here has surpassed the 400,000 mark. And here we do have some Southeast Asian countries below Bangladesh as well. And Malaysia, in the meantime, has also seen record high daily figures. Since Saturday, there were 2 times there were single day record highs since Saturday. And Sunny will connect to Malaysia, to Kuala Lumpur later via Skype. But before that, let's take a look at the total number around the world, which stands at around 43.7 million, and 1.16 million people have lost their lives from the coronavirus around the world. And those are the updates I have for now, but I'll be back after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Meanwhile, a silver lining of sorts amid the pandemic is the greater focus on physical well-being and related efforts to maintain a healthy lifestyle. For more on this trend, I have our Kim Dami here in the studio. Welcome, Dami.
Good afternoon, Sunny.
So I hear there's been a tangible shift in dining patterns amid the pandemic. Tell us more.
Right, so staying at home longer means eating in more often. And more people, including myself, are turning to healthier home-cooked meals. This woman in her 30s and now prepares her meals at home, but cooks with less spices and tries to cut down on her sodium intake because she is tired of delivery food and is also concerned about her health. When she wants to add some flavor, she tries to use only a natural seasoning. According to the market data, sales of healthy food products have soared amid the COVID-19 outbreak. An online grocery retailer saw its sales of low-salt and salt-free products nearly double in the first 9 months of this year compared to the previous year. The most popular items were butter, nuts, and chicken breast with less or no salt content. To meet the growing demand, food makers are also offering low-sodium canned ham and fish cake products.
We eat more home-cooked meals because of COVID-19, so I'm trying to reduce my family's sodium intake.
Juice and snacks with less sugar and gluten-free bread are also popular. According to a local convenience store chain, the sales of low-sugar or sugar-free reconstituted milk products and soft drinks rose by around 50% on-year in the first 6 months of 2020. These new products advertise a great taste while supporting a healthy lifestyle, and their demand is only expected to rise.
Now, Tami, I understand that people are also purchasing more household appliances.
Right, with more people now eating at home, this has led to higher demand and interest in kitchen appliances. Here, a woman actually visited the store to buy a new washing machine that she had eyes on for months. And she says she finally decided to splurge on this appliance because it was difficult to do all the dishes while feeding a family of 4 at home.
I think it's really convenient because these days I have to wash more dirty dishes, since we're eating at home more often due to COVID-19.
Washers and dryers usually come in big sizes, but smaller and more compact machines have become more popular as of late.
Customers are looking for appliances that can help out with their household chores, since people are now spending more time at home.
In fact, more than double the number of dishwashers were sold in the third quarter compared to the same period last year, while the sales of microwave and air fryers rose 15% and 5% respectively. Also, the sales of garbage disposal units skyrocketed more than 9 times compared to a year earlier. With the pandemic showing no signs of drawing to a close, home appliances sales are expected to trend upwards.
Right. Now, Tami, eating healthy is one thing. What about exercise? How are people finding ways to stay fit?
So although gyms are now reopened under eased social distancing measures, people are still hesitant to go there. And according to a recent survey, 7 out of 10 Koreans said they're now working out at home. Whether it's through live connections on YouTube or Instagram, fitness fanatics are finding ways to exercise without leaving the house. This 25-year-old Yang Dae has become one of these home fitness fanatics. With the COVID-19 pandemic forcing her to stay long hours at home, she has turned to virtual workouts. She does 5 to 6 routines every day without ever needing to go outside.
Home fitness is more convenient and easier to fit into your daily schedule. Not to mention it's private and less expensive. The fear that any other virus could spread even after COVID-19 makes me want to keep this home fitness as a consistent habit of mine.
While some people have turned their homes into a gym, others have transformed it into a studio to tap into their artistic talents. By drawing the curtains, a simple living room became a home studio set for these twin influencers.
요즘 집에만 있어서 정말 답답하시죠? 집에서도 신나는 동작으로 함께 이겨내요. 끝까지 화이팅!
And the popularity of home fitness videos has prompted influencers to focus on related content.
In a way, everyone has a home. We could rent a studio, but we wanted to show us working out in a normal, everyday life so that exercises seem more accessible. All you need is your body and a simple mat.
The calm and relaxing effects of yoga have proven to be popular as well. Named Yoga Boy, a yogi YouTuber living in Michigan, streams online sessions to help subscribers feel like they're working out together.
Communicate with my subscribers as much as possible. I respond to questions regarding difficult positions or put people's requests or ideas into the content I create.
To stay motivated and connected while exercising at home, people have also created virtual groups. With easy access to renowned instructors, minus the travel time, all at a much lower cost, this trend is likely to be a mainstay in the realm of personal fitness, even long after pandemic is over.
Right. Now, that is something I would like to try. All right, Tami, thank you very much for the coverage. I hope to see you again soon.
My pleasure.
Right, it's time now for the regular afternoon briefing on COVID-19 here in this part of the world. Authorities have identified 3 major risk factors to current containment efforts. They include transmissions at care centers for the elderly, rise in imported infections, and a rise also in autumn-related activities. We'll come back to you afterwards.
First of all, we have Mr. Kwon Junuk with the explanation. Let us now begin our regular briefing on COVID-19 situation here in South Korea for October 27th. We have a total of 72 new local infections, and the total caseload now stands at 26,043. 76 more people have been discharged, while 1,602 remain in quarantine. We have 52 patients in severe or critical conditions, and we had 3 more fatalities. And I extend my deepest condolences to the deceased and the members of the bereaved families. And as of today noon, we have some updates on the domestic infections by region. So here are the details. Please note that the figures could be subject to change. And starting from the metropolitan area, in relation to a golf meeting in Yongin City, Gyeonggi-do Province, we also have the first index case earlier, and we have 30 additional cases, and a total of 31 people have been confirmed to date. And in Gwangju City, in relation to the SRC Rehab Hospital, we have 2 additional cases, raising the total to 137. And in relation to Haengbokke Nursing Home in Namyangju City, we have 3 more people being confirmed, raising the total to 62. And in relation to a healthcare facility in Gumpo City and care facility in Anyang City, we have 2 additional cases being confirmed, making the total to 46. And in relation to a welfare facility for the disabled in Yeoju City, we have 2 additional cases, raising the total to 30. And in Seoul Metropolitan City, in relation to Gwanakbu District Sammo Sporaks, after the 24th of October, we have additional 4 cases, and 17 cases have been confirmed to date. And in relation to a Yeongdeungpo District family meeting, we also have 13 additional cases being confirmed. A total of 14 have been confirmed to date. And in relation to a family in Gurogu District, we have 2 additional cases, raising the total to 46. And in other regions, in relation to Seogu District in Daejeon City, we have the daycare center there. We have 5 additional cases, raising the total to 6. And in relation to a family gathering in Changwon City, Gyeongsangnam-do Province, we have 4 additional cases. A total of 14 have been confirmed to date. And as for treatment that are carried out here in Korea, remdesivir has been administered to a total of 685 patients across the country at 63 hospitals here in Korea. And in relation to the safety e-report run by the Safety Ministry, we have updates. And as we have the easing of social distancing level 1, we have many reports in relation to social welfare services, and many of they were in relation to the fact that the managers and users did not wear face masks properly, and also we had some quarantine measures that were not abided by these multi-use facilities as well. And as for in-person forums, there were some forums where face masks were not worn, and they did not keep social distancing measures as well. And the health authorities continuously would like to note that COVID-19 is also at the verge of a large, massive resurgence. So we ask the public to take particular precautions. And especially during the weekend, we ask you to also refrain from going to large gatherings marking the Halloween weekend. And we have some precautions to you once again. If you have any symptoms like fever or respiratory symptoms, please do not go to large gatherings. And instead of having large-scale gatherings, please utilize online means and remote meetings as well. And also refrain from going to multi-use facilities as well. If you have to inevitably go to these facilities, please minimize your time of stay there. And also, after returning from these meetings and facilities, if you have any symptoms, please get tested as soon as possible. Wear your mask properly, and also keep 2 meters of healthy distance, and wash your hands on a regular basis as well. In particular, in terms of gatherings that are taking place indoors or even outdoors when it is difficult to keep healthy distances among others, please wear your face mask at all times, and please refrain from any activities like singing that could increase the travel of respiratory droplets, and also please do not share meals together. And during the holiday season and the year-end season, we believe that there could be many many gatherings and events being scheduled, but when you go there, please take particular precautions and please abide by quarantine measures. All of the managers of multi-use facilities need to also screen the temperature of the users and also keep ventilating the space as well. Last but not least, we have a few words for the public. Ahead of the winter, we believe that the COVID-19 here in Korea is stabilizing to a large extent, and it is under quite a large amount of control. However, we still have any possibilities that could lead to a massive outbreak at any time. And in particular, the health authorities are currently noting the fact that a lot of the infections, actually 70 to 80% of the latest domestic infections are clustered in the Seoul metropolitan region. And we say the Seoul metropolitan region is actually very prone to large infections because more than half of our country's population are clustered in this area as well. And globally, the COVID-19 situation is worsening as well. And many experts here at home and abroad also have expected and forecasted earlier that in the Northern Hemisphere, in the US and many countries in Europe, they have seen a large, massive outbreak once again. And in the past, we have had some great concerns of a massive outbreak here in Korea, and we have three risk factors. And we also said that lower temperature would also make it less easier for COVID-19 to spread. And also, we believe that there are also increase of the indoor activities during the winter as well. And also, we have the large, massive possibility of an outbreak of influenza as well. And also, we have had some of these concerns to begin with. However, on the other hand, we have also some positive sides, and we believe that compared to the summer, we believe it is a better condition for us right now to wear face masks on a daily basis. And probably, we believe that this year's winter would also be very crucial and very important ahead of the vaccination that could happen next year against COVID-19. And this could be our second or even last winter ahead of a possible massive vaccination against COVID-19. And we are walking towards this last winter ahead of the development of vaccinations. And in order to ensure a safe winter, we need to make sure that during the winter holidays, we need to also refrain from going to large-scale gatherings, whether they be personal social gatherings or religious gatherings. And please minimize the number of attendees. And if possible, I would also like to highlight as a person in charge of quarantine measures to help us to make the fact that we need to refrain as much as possible to having these people gatherings as well. And we believe that we also have higher risks of silent spreaders. And if we keep containing to these quarantine measures, we will be able to cut off the chain transmissions through these silent spreaders. And we can also cut an end to the large-scale cluster infections stemming from the hospitals and long-term care centers. I have great pride and great confidence in the pride and the energy of the public, and I believe that we can overcome the COVID-19 and contain the virus. Thank you very much.
Right, that was Mr. Kwon with Tuesday's afternoon briefing. So, what was the gist of his address today?
Well, he had some updates on the cluster infections, especially in the metropolitan region. Just to name a few, at a rehabilitation hospital in Gyeonggi-do province, 2 additional cases raised the total there to 137. And there was also 62 cases in total at a nursing hospital, also in Gyeonggi-do province, with 3 additional cases. And also a new cluster infection related to a golf meeting also in Gyeonggi-do province in the the city of Yongin, with 30 cases confirmed there, raising the total to 31. And due to these infections in the metropolitan region, not only in the metropolitan region, there was also a daycare center infection in the city of Daejeon, for instance. Due to this and also the upcoming Halloween this weekend, Kwon had he mentioned some restrictions as well as guidances ahead of that special day, as well as more and more people expected to travel during the autumn season. So he called on people who have any symptoms such as fever or respiratory symptoms to not attend any gatherings or events and try to turn to alternatives such as online gatherings, and to refrain from using multi-use facilities, and especially to wear masks when they are indoors.
Right. Okay, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Also, in related news, calls for social distancing amid the pandemic have turned the demand for non-face-to-face transactions from simple convenience to a health necessity. Up next, we bring you details about the latest on no-contact solutions.
Today, we're at Suso Station in southeastern Seoul, used by thousands of rail passengers on a daily basis. Conventional ticket counters and vending machines, which come into frequent contact with rail passengers, have been identified as potential vectors for COVID-19. To keep passengers safe, the station has installed a new contact-free ticket vending machine, installed with motion-detecting sensors that can pick up movement from 2 meters away.
코로나19 감염병 예방을 위해서 에어터치 스크린을 설치해서 고객들의 좋은 반응을 받고 있습니다. 향후에는 더 확대해서 감염병 예방에 적극적으로 협조하도록 하겠습니다.
COVID-19 can spread easily through elevator buttons, handrails, door handles, and other frequently touched surfaces. Antimicrobial films have been used to cover elevator buttons. But some anxious citizens have even used their personal belongings to press buttons on an elevator. One shopping mall in Thailand even installed foot pedals to replace the elevator buttons. Korean researchers have developed a cutting-edge sensor that can detect the moisture of human skin at an ultra-low proximity of 1 centimeter. Japan's All Nippon Airways has installed a hands-free restroom door at its airport lounge in Tokyo, which is opened by using one's elbow to push the door open. Even DUI checkpoints have undergone many changes. A local law enforcement agency has developed a contact-free breathalyzer to keep themselves and drivers protected from COVID-19.
기존의 음주 단속을 할 때는 후 부는 방식으로 해서 비말이 튀게 됩니다. 그래서 경찰청에서 연초에 이 비말 튀는 위험성 때문에 음주 단속을 일제 중지했습니다. 이 때문에 이제 음주 사고가 늘어나면서 비접촉식 음주 감지기를 개발하게 되었습니다. 공기 중에 있는 알코올 성분이 있으면 MQ3라는 알코올 감지 센서가 발열을 해서 공기 중에 있는 알코올을 감지를 하면 이걸 이제 전자적 신호로 보내가지고 이제 경고음을 주는 거죠.
We compared the new contact-free breathalyzers to conventional devices used in the past. When drivers breathe into a regular breathalyzer, the device is coated in potentially dangerous respiratory droplets. However, the contact-free breathalyzer simply detects the presence of alcohol in the air of the vehicle.
선생님 감지기에 호흡 불지 마세요. 마스크 좀 내려주세요. 예, 선생님 음주 감지되셨습니다.
This humble solution devised by Lieutenant Lee passed all evaluations with flying colors and are now being used in traffic stops nationwide.
네, 현재 비접촉 음주 감지기는 전국 경찰서에 2대씩 약 500대가 시범 운영 중에 있으며 경찰 쪽에서는 향후 이를 추가 보급하여 확대 추진할 계획입니다. 코로나19 시절에 맞춰서 본 비접촉식 음주 감지기처럼 다양한 제품이 많이 나왔으면 좋겠습니다.
In the face of adversity, ordinary citizens have stepped up with innovative solutions to help us in our fight against COVID-19.
Over in Malaysia, health authorities there noted a fresh daily high on Monday with 1,240 COVID-19 cases. For more on the situation in the Southeast Asian nation, I have Mariana Kim live on the line. Hello again, Mariana.
Hi there, Sunny.
Right. What appears to be fueling the resurgence then, Mariana? When exactly did it start, this resurgence?
Well, it started about a week or two ago, I want to say. And like you mentioned, just yesterday, we saw an addition of 1,240 cases in Malaysia. But it sounds like a lot, but it's mostly concentrated in a region called Sabah, which is in East Malaysia across the South China Sea. And there it's had 900 cases, 800 cases additionally on a daily basis. But here in Kuala Lumpur, which is the capital of Malaysia, of course, added 17 new cases. So in this part of the region, I think by and large, it's been largely contained. Penang, which is by the Malacca Strait, currently has two major COVID-19 clusters. And you may have heard the prison outbreak, if you will, the Penang Remand prison cluster and the Jawi prison cluster. And both these prisons were the third and fourth penal institutions in the country to record a large number of COVID-19 infections. To sum up, since the start of COVID-19 outbreak in Malaysia, the number of cases has exceeded 27,000, but a significant number of people have recovered, and the death toll stands at about 230. So I want to say the government has done a fabulous job in clamping down on this disease, and it has introduced some various strict measures to restrict movements in order to clamp down on the transmission of coronavirus. And right now, in fact, just yesterday, the government extended what's called a conditional movement control order, which is extended till November, 9th of November. And this means that schools and religious institutions are closed. Parks are not accessible unless you're jogging in the parks. And also there's a limit in the number of people that can get in a car. And then in a restaurant, only a group of 4 people can dine together. And so various restrictions here and there that we're seeing in Malaysia.
I see. I also understand, Mariana, that King Al Sultan Abdullah has rejected Prime Minister Muhyiddin Yassin's request for a state of emergency to be declared. How is the public responding to the latest events, including the measures that you spoke of to better contain the outbreak in Malaysia?
Right. Not to go specifically into the political upheaval, but things have largely been orderly, I want to say, and people have been quite mature about the inconvenience that the latest CMCO has brought about in their lives. And unlike the cases in Europe or even in the US, where you see lots of protests and rallies against mask wearing and whatnot, Malaysians by and large have been very obedient and have been adhering to the strict measures that are imposed. And Malaysia has been in some form of movement control order since the middle of March. So you can imagine it's been more than half a year. So there is palpable frustration, I want to say, in the public, among the public, but people are also very determined to really clamp down on the spread of coronavirus. So I think kudos to everybody here.
Meanwhile, Mariana, you are the communications manager at AirAsia. How is the airline industry coping with the fallout from COVID-19?
Yeah. Well, to quote our CEO, Tony Fernandez, this is the greatest challenge that those of us in the airline industry has ever faced, really. And but AirAsia, I want to say, has been barely handling this situation, this crisis really quite well, and coping with the effect of the pandemic, mostly thanks to our low-cost business model. Now, where full-service carriers have had to adjust to the reduced capacity and the absence of long-haul routes, AirAsia had really the right product, and we're in the right part of the market to recover faster, I want to say. And most of our flights or short to mid-haul. So that's been easier for us to deal with. And we're cautiously optimistic that we're seeing light at the end of the tunnel. And when we resumed our domestic flights in May, in fact, we saw a V-shaped recovery in demand. So we do feel like there is pent-up demand for travel, and that when things resume to somewhat normal, a new normal, we will see travel pick back up, and especially international flights when borders open and travel restrictions are lifted. We're hoping to see more travelers really going on revenge travel. You know how people go on revenge spending.
Right.
So yeah, and just a quick note about Korea. It has remained one of our most important international markets, and we do hope to resume our flights to Incheon, Busan, and Jeju, because those have been really popular among our travelers from Southeast Asia.
Right, Mariam, we'll keep our fingers crossed for that. Thank you very much for making the time to join us live at this hour with your thoughts.
Thank you, Sunny.
The next few months are going to be very tough, and some countries are on a dangerous track.
인플루엔자 자체도 코로나에 못지않게 굉장히 위중한 감염병입니다.
The pandemic is plaguing the world amid its persistent cycle of containment and contagion. While Korea, for its part, appears to have avoided the worst of the situation, authorities fear complacency may trigger another large-scale outbreak amid the current level 1 social distancing. For more on this situation, I have Professor Kim Moon-gyu, the Director of the Global Development Center at the Yonsei University Health System. Welcome back, Professor Kim.
Thank you for having me.
And I also have Dr. Alice Hyung-Tan from Ms. Mary Women's Hospital. Good to see you again, Dr. Tan.
Thank you.
Professor Kim, it's been about 2 weeks since Korea's social distancing was eased to level 1, which requires local transmissions to hover below 50. How would you assess the current COVID-19 situation here in the country?
Well, compared to other countries, I would say so far, so good. Well, some European countries are letting their local governors to lock down if they have more than 50 cases per 100 million. So if you compare with our country, we can have thousands of patients still not needing lockdown. Well, anyway, that's a situation in Europe, and ours is better than theirs. And in Korea, every new one case of COVID-19 needs about more than 20 persons to be screened. So that means a lot of work and efforts. So we still need to do the efforts that we've done to wear masks, hand hygiene, and social distancing. And I think the government is worrying about the economy and every education, every aspect. So they will decide the level of 1 or 2, but anyway, I think it's good.
So far, it's okay. Right, Dr. Dan, there is growing concern, however, over the possibility of another outbreak at nightlife establishments in light of Halloween celebrations this coming Saturday, if I'm not mistaken. Now, accordingly, some are calling for the closure of clubs and bars ahead of the weekend. Do you support these calls?
I don't think we necessarily need to shut down these businesses. I think that there is a way that we can socialize responsibly. If we've learned anything over the last 9 months, is that COVID-19 is a controllable disease. We know the high-risk physical activities that spread the virus, anything involving physical contact and vocalization, such as shouting, singing, even talking. We also know what are the physical environments that facilitate spread. So places that have poor ventilation, that are crowded, that are not doing the disinfection of high-touch surfaces that need to be done. And so the Seoul metropolitan government, actually throughout the country, they have started to step up with inspection of these nightlife venues. They started last week. They will also be doing inspection on site when these venues are open between 10 p.m. and 3 a.m. And it's a one strike, you're out policy. In other words, if these businesses are not following the core infectious disease prevention and control measures, such as taking temperatures and having a log book, making sure that spacing is adequate among guests and that everyone is wearing a mask, if these measures are not followed, then the business will be closed, and there's no second chance. And so from what I've seen, and this is anecdotal, but from what I've seen, the business owners of these nightlife venues, they are taking this very seriously. They're taking COVID-19 seriously, and I've actually been quite impressed with the measures that they've put in place. At the door, they have security guards, they have the thermal checks, they have the digital and analog guest books, they have the place markers on the floors to ensure physical distancing. I've actually been quite impressed. I mean, club owners are doing a great job, maybe better than some the White House, in terms of controlling and preventing infection. And so I don't think we necessarily need to close them down for Halloween.
Right, well, that is comforting to know. Dr. Tan, authorities yesterday during their briefing also identified key variables in their containment efforts, and they include a rise in autumn outings, a rise in imported transmissions, and of course cases at senior care centres. Now, given that reality with regard to nursing centres for the elderly, surely more stringent measures are needed there then?
I agree. We do need to pay special attention to these centers because of the vulnerable population that are living there, and they have special conditions that make infection, disease control, and prevention that much more difficult. For example, many of these residents have poor communication, so they're not able to let people know if they feel unwell. They may be weak, so their bodies may not be able to mount the kind of fever or response to an infection that can be detected early. Also, they have many limitations so that they need intensive high-touch one-on-one care for their basic, what we call activities of daily living, such as eating, toileting, and moving around. And so they need someone to come in close contact with them just for everyday life. And so we do need special measures. One of these special measures is the preemptive screening of all residents and staff that's been going on. I think it started last week. My suggestion is that this preemptive screening be done on a routine and recurrent basis, so maybe twice a week. This is actually what's going on in some university campuses, such as MIT in the United States. All students, staff, professors are being tested twice a week. That's thousands of people. But it does seem to be working, and that's something that we can consider. Another option, perhaps it's a little bit extreme, but something to consider is having a residential live-in option for staff. So having a team of staff members that work, or they commit to a 1-month period of working for 3 weeks, they live and work and eat on the premises. And then the 1 week prior to starting work is sort of a quarantine period where they are quarantined on site and they're tested every day to make sure that they're safe. That eliminates or decreases the risk of asymptomatic carriers among the staff. And that's really what's going on, is the virus is being brought in from the outside, in addition to all of the conventional measures that are ongoing, such as limiting the staff and all of the strict disinfection that's going on. These are perhaps some measures that can be considered.
Right. Professor Kim, health officials claim they have found no direct link between their vaccines, flu vaccines that is, and the recent fatalities of largely elderly citizens. They're now renewing calls for people to get their flu shots, revealing that some 3,000 people lose their lives annually to the seasonal flu. What are your thoughts on this?
Well, the accidents happens from all 4 companies making that flu vaccine, and the area is distributed to all the countries. So it's hard to say the mortality is from the virus if the vaccine is injected properly, stored properly. And every year in October in Korea, I mean, we have about 1,000 deaths and 10% of them are unknown cause. So we have a similar data from America that every 1 million doses of flu vaccine, there is about 60 cases of mortality within 1 week. So the Korea CDC reported recently that there was about 13 cases of mortality because of the vaccine. I think most of them from anaphylaxis, which is the severe type of allergic reaction, and 3 of them are from flu vaccine. So it's a very rare phenomenon. So why do we have this kind of news every day about this thing? I think it's partially because of that recall bias. So people remember only they are interested in and neglect other things. So we should remember that the Korean government is trying to prevent unnecessary early death during this season. So flu vaccine is still needed for most of the population.
Right. Meanwhile, Dr. Tan, for those who prefer to err on the side of caution, what are some ways or what are some things that can be done to address the potential risks of side effects when receiving flu shots?
Well, one thing that you can do is the day of the vaccination, make sure that you're feeling well. You know, if you have a fever, you're feeling weak or have muscle aches on that day, postpone the vaccination. You know, just wait for a day when you're feeling completely well. The second thing is make sure you're very well hydrated the day of the vaccination. Make sure you've got at least 3 to 4 cups of water in you before you go to get your shot. Plan ahead. So after the shot, it's recommended that you stay in the clinic or on the medical premises for 20 to 30 minutes after the shot, just in case there are any reactions that need medical attention. So plan ahead so that you can stay in the clinic for that period of time. You should avoid tub baths for 24 hours after the vaccine, and then let your friends and family know, hey, I got a vaccine today, so that people can keep an eye on you and make sure that you are looking okay. If there are any signs of danger, that they can call a medical professional right away.
Right. Professor Kim, the number of imported cases here in Korea in recent days has been on the rise. What are some ways to better deal with this reality, do you think?
Well, there are ample evidence that we should be cautious about that imported cases. And why there is a rise in Europe and other American countries, there might be 2 factors. One is the human factor, the other one might be the virus factor. And well, the human factor might be the behaviors of those countries, people that they neglect some efforts to keep masks on and every efforts of the social distancing. The virus factor might be the weather, I guess, since the temperature is going down and humidity is going down. The virus might live outside longer than the summer times. And until now, I don't think there's a new strain appearing from the global report, which is the D614G. And well, if we have a new strain, that might be the cause, but I don't have the information yet. And recently, there was a report from Chile that they have a new strain, but we don't know the characteristics yet, so we have to wait and see for that. And for our country, I think government will handle it. I have a senior colleague who recently returned to Korea from other country. He had a COVID-19 and he was confirmed negative at the country, but at the airport, he was confirmed positive. So we had to stay in the hospital almost 2 weeks. And now he's off because he had 2 negative results. That means Korea is doing a very strict and highly controlled measures right now. So if we can continue with that, I think there's nothing to worry about yet.
Right. Meanwhile, Dr. Tan, the global health body has raised the alarm over the recent surges across the world, especially in the northern hemisphere. What appears to be fueling this disturbing trend, and what are some ways perhaps to turn the tide around? I realize today I'm asking you a lot of questions about ways to deal with the pandemic, but perhaps with the global situation, what would be your words of recommendation?
Right. So an effective COVID-19 strategy, it would take hours for me to go over all of the details, but if we were to distill the most important components. It's one, unity, and the second is timing. The unity needs to be comprehensive and it needs to be complete. It's the kind of unity that wins wars and wins world championships for sports events. You know, that's the kind of unity that we need. In order to get this kind of unity, we need great leadership at all levels, from the top to even leadership in the home. As a parent, you need to teach your children what to do. But you also need unity in messaging, in purpose, and in effort. And so not just leadership, but you need something that I call fellowship, which is not a word in the English language, but basically it means public engagement, active compliance. People need to do the right thing. So unity is one. The second is timing. The timing is very crucial. It needs to be quick because the virus spreads so quickly and so easily. We saw in our Paju Starbucks case, it just took a few hours and dozens of people were infected. If we didn't have the kind of monitoring that was so intensive in our country, it could have spread in the community very quickly, and you can get a huge hundreds of cases within the community very quickly, and that leads to a surge of very sick people. You get overwhelming of the healthcare systems. And so the timing is very crucial. It needs to be quick. But in order to do that, you need intensive monitoring, and you need to set a very well-defined threshold for when you are going to intensify social distancing and ramp up your testing in terms of numbers and how broad you're going to do the testing. And this, of course, takes a lot of resources for epidemic surveillance. And so in terms of what needs to be done, it's concentrate on unity and on timing. The countries that have done that successfully, they've really gotten good control. The ones that are disjointed or delayed, they're still suffering.
Right. All right, Dr. Tan, as always, thank you for your thoughts, and Professor Kim, thank you for being with us today.
Thank you.
Right, on that note, we end our coverage for this Tuesday. Be sure to join us tomorrow as we take a look at the need for collaboration in combating COVID-19. In the meantime, take care and see you tomorrow.